And Brian, did you have a question?
Yeah, I'm trying to understand why you're suggesting lowering the threshold from below 400%. I heard you say you wanted to free up money for others, but that number is 400% aligns with other benefits related to healthcare in terms of tax subsidies. So I'm just curious, like, why you would want to mess with that, because the federal government has made policies with those thresholds for a reason.
Right, and that's what Ledge Council was exactly reminding me of, is that there is actually a third part of this, which is really attached to that first part, which is changing. Again, but this, my understanding was that we had that needed to ripple through, that 400% needed to ripple through, and I guess that 400% therefore would now appear elsewhere, and that I have to admit I'm a little bit confused about. I guess it appears at the very bottom, the very last page from.
Here from Legislative Council. Yeah, do you want to?
Sure.
Go.
Right here, Kirby, Office of Legislative Council. So yes, in the bill, in the underlying bill, there is the reference this committee had put into the patient financial assistance policies at large healthcare facilities, and making sure that the individuals were aware of that potential assistance in the future. And so the first instance of amendment here and the third instance of amendment are connected, because the third instance of amendment would amend your existing patient financial assistance policy language in Title 18 to reduce the eligibility for the minimum 40% discount for patients with income currently between 250 and 400%, would reduce it to 300% there, and have that same 300% reflected in the description of the policy in the first instance of amendment. So taken together, the amendments as far as the financial eligibility piece would have eligibility for the debt repayment under medical debt repayment under S27 go up to 300% of the federal poverty level, and that would align with also a 300% eligibility for patient financial assistance at large healthcare facilities.
Oh, wait, hold on. I have lots of people with lots of questions.
Yeah,
Did you want to finish your
Yes.
question?
I did.
Okay, can you finish that,
Yeah.
please?
Well, just a response to that, I think changing the threshold is out of touch with the real experience of working Vermonters. As a person who makes less than 400,000, less than 400%, there's no way as a single person I can handle any medical expenses right now. I don't even go to the doctor when I'm sick. I can't imagine having a child and having that happen to them. And I think it would be kind of unwise to mess with this. I think we should try it the way it is first, but that's just my response to it.
Alan?
Brian's about 400%. I'm okay.
Okay. Lori?
I have real concerns if we're changing a statute we passed in a previous session with absolutely no testimony on that, and I will be voting no on this amendment.
Leslie? No, oh, I thought you had it. Oh, Mari, sorry.
What's your understanding of what 400% of federal poverty level is as far as an income, like for one person?
Yeah, for a single person, it's 400% works out to about a little over $60,000 a year for a single person, and for a family of three, in 2025, it's about 104,000, just shy of 104,000.
62,000 is a little bit over 62,000 is correct.
Yeah.
400. The amount, do you know what the amount of it costs for a family, I'm going to say a family of four to live in Vermont, what the estimated amount it is for a family of four to live in Vermont?
Yeah, it's expensive. I was a family of six. So yeah,
Hundreds of thousands.
and I'm right in that 400, FPL level. So it's a
Hundreds of
challenge.
thousands of dollars. Yeah. So
Fully aware of that.
reducing the number from 400% to 300% is really unrealistic in today's Financial Times and I can support it.
To your point about trying to provide more for people who need it, maybe it wouldn't be in this amendment, but I would be open to further discussion about how we can look at how those with the most might give back a little to help those with the least. Like there's some, the people at the top are making more than they ever have. So perhaps like, down the, maybe it's more of a ways and means discussion of like a surge that goes into a fund that can support programs like this. But I don't think the way to do it is to mess with the threshold. But I hear your concern that there might be people who make less, who need a lot more. And I would hope that the treasurer and the company that they contract with can use negotiations to get the best possible deal to buy off medical debt. Because someone could have like $5 million in medical debt and they can negotiate that down. So there's room there to cover more people in that negotiation. But so I hear your concern.
Yeah, and I really appreciate what Rep. Houghton had to say about those negotiations that occur. So,
Yeah.
so maybe all that is already covered in what I was trying to accomplish with this. I mean, at this point, based on the conversation, I'm fully willing to just withdraw this. I mean, it necessarily need to proceed. But just thankful that y'all, invited me in to have this chat.
All right, thank you. So it's our understanding that you will be withdrawing?
Yes, do I do that on the floor or just
Just
procedurally? How does that work? Talk to the speaker? Okay.
Yep.
Great.
And we don't need to.
They'll tell you the language.
Okay.
Yeah, thank you all very much. I really appreciate it.
Ken?
Yes.